COVID-19 research. The Ministry has been scientifically tracking all affected and exposed people in the country and developing a knowledge base that has led to develop COVID-19 testing strategies, management protocols, and pandemic containment efforts. Hopefully, in the coming days, we will be able to share with you some of the findings of our researchers, particularly as regards the level of exposure or seroprevalence of the disease in the country. Interventions for COVID-19 containment, prevention, and management continue to be guided by the highest standards of evidence available, both locally and globally. However, until the outcomes of the research being carried out are made available, we continue to urge our people to strictly adhere to the containment measures we have continually advised on: maintaining social and physical distance, wearing of face masks in public places, washing of hands with soap and running water, and avoiding all public and social gatherings, among others. Let me now switch to the numbers for today. Today we have 120 people who have tested positive for COVID-19. This is from a sample size of 2,221 that was tested over the past 24 hours. The total caseload in the country now stands at 6,190, and the total number of samples tested at 167,417. All of today's cases, except 5, are Kenyans. 84 of these 120 are male, while 36 are females. The youngest is 6 years old, and the oldest is 83 years old. The cases are distributed in the counties as follows. Nairobi has 67, Mombasa 17, Kajiado 9, Machakos 9, Kiambu 8, Uasin Gishu 4, Nakuru 2, Kilifi 2, and Narok 2. In terms of the sub-counties, I will give the first Nairobi. The 67 cases are in Westlands, 12, Dagoretti, North and Langata, 11 each, Kibra 6, Madara and Starehe 4 cases each, Kamkunji 3, Embakasi Central, Embakasi East, Embakasi North, Embakasi South, Embakasi West, and Mathare have 2 cases each. Kasarani, Roysambu, Ruaraka, and Umoja have 1 case each. In Mombasa, the cases are in Vita 6, Jomvu 5, Changamwe, Kisauni, and Likoni 2 cases each. In Kajiado, the cases are in Loitoktok 6 and Kajiado North 3. In Machakos, the cases are in Athi River 4, Machakos Town 3, and Matungulu 2. In Kiambu, the cases are in Juja 3, Gatundu South, Githunguri, Kabete, Kikuyu, and Limuru 1 each. In Uasin Gishu, the cases are in Anapkoi 2, Kapsaret and Tarbo 1 case each. In Nakuru, 2 cases are in Naivasha, while in Narok, the 2 cases are in Narok North. I'm also glad to inform you that we have also discharged 42 patients from various hospitals, bringing the total number of recoveries to 2,013. We take this opportunity again to thank and celebrate our healthcare workers for their dedicated work for this achievement. Sadly also, we have lost one more patient to the disease, bringing our fatalities to 144. Our condolences to the family and friends that have lost their loved one. Today, we are also joined here by two of our partners in health, namely the United Nations Population Fund, or UNFPA, and the Red Cross, Kenya Red Cross. The UNFPA has made a donation of assorted personal protective equipment, or PPEs, amounting to US dollars 223,000. For a long time, UNFPA has been collaborating with the Ministry of Health in providing reproductive, maternal, and newborn health services. These PPE kits will go a long way in enhancing healthcare worker safety during provision of these key services. The Kenya Red Cross is one of UNFPA's implementing partners and a key player in facilitating the purchase and storage of these items, as well as support in distributing them to the various counties. These items will be distributed to the counties of Nairobi, Kitui, Mombasa, Kwale, Migori, Lamu, Kisumu, Busia, Kilifi, Narok, Homa Bay, Marsabit, Isiolo, Mandera, and Wajir, as well as the Family Health Options Kenya, a local NGO, I think. We thank you, UNFPA, and your implementers, Red Cross, for this donation and the support that you continue to provide, and we look forward to further collaborations. I thank you, and I would now like to give the country director of UNFPA a minute or so, and the Red Cross deputy director as well, to address you.
Thank you very much, Cass. The Chief Administrative Secretary, senior government officials, the government spokesperson, my colleagues from Red Cross, ladies and gentlemen. First, permit me to acknowledge the leadership that His Excellency the President has provided to the COVID-19 pandemic response in Kenya, as well as the evidence-driven leadership that the Ministry of Health has provided to the national response. This has meant the difference between some of the predictions that we have heard with regards to countries on the continent and the results we have in Kenya. As the Chief Administrative Secretary said, for us as UNFPA, we remain committed to our work to ensure that we bring preventable maternal deaths to zero. We bring gender-based violence to zero, and unmet need for family planning also heads to zero. We have continued to collaborate with the Ministry of Health, our partners, the Red Cross, and county governments to ensure that these services are provided. We are today ensuring that the counties and the healthcare workers are able to provide the critical services needed for women and girls in those communities. And in addition to these PPEs, we're also providing about 24 million Kenyan shillings to the Ministry of Health to support the continuation of services across the counties. Additional 20 million shillings to the select counties that the CAS had mentioned, so that health workers also on the ground can provide services. We have been able to mobilize $2.8 million in support of the procurement of family planning commodities, also to ensure there is no gap. CAS, ladies and gentlemen, I'd like to thank you for the collaboration, and I'd like to flag one thing. As you have said, the COVID-19 pandemic has provided for us further challenges across board. We are seeing increases in regards to teenage pregnancy as well as gender-based violence. We also note the controversy around the reproductive health bill. Our position at UNFPA is this: we will continue to work under the leadership of the ministry, listening to the range of partners who have legitimate concerns, talking to all stakeholders to ensure that at the end, the rights and the well-being of women and girls are protected and respected. Thank you very much, Cass, and we look forward to your continued leadership.
Thank you.
Thank you very much, Cass. Good afternoon. Good afternoon, ladies and gentlemen. Today, we are here as Kenya Red Cross to appreciate the partnership that we continue to receive from our partners, the UNFPA, but also from the close relationship that we continue to have with the Ministry of Health. Kenya Red Cross, as an auxiliary to both the national and county government, we are committed to supporting the government efforts of enabling the communities to respond to COVID-19 effectively, both at the national level and the county level. As first responders, our volunteers are on the ground in all the 47 counties to support these efforts by our government. We are educating communities, we are promoting behavior change communication, and providing the necessary supplies and equipment to enable communities to respond effectively. For us in the Kenya Red Cross, the health and protection of the healthcare workers and the first responders is paramount if COVID is to be prevented and stopped in this country. That is why today we are happy to receive this donation from our long-term partner, the UNFPA. These PPEs will enable the healthcare workers to deliver their services effectively in all these counties that have been mentioned, the 15 counties. We continue to appreciate the relationship, and we want to assure the Ministry of Health that we will continue to work together with you to support all your efforts as an auxiliary to the government. We'll continue to fight this pandemic together. We'll continue to build the capacities of our communities and the capacities of our healthcare workers to support the response. Thank you very much.
Thank you.
Thank you very much. Chance to ask a question. First, you know the drill, the name and the media house that is present, and the show.
My name is Helen Aura from NTV. It has come to our attention that there are a certain number of members of parliament who have contracted COVID-19. Can you actually confirm this, and how many of them are in critical condition? My second question is also regarding the public gatherings. If an individual actually contracted COVID-19 during one of these political public gatherings, would you hold some of these political leaders accountable for the spread of this contraction during these gatherings? Thank you.
My name is Chamutai going from Citizen TV, and my question just rides on Elena Aura's question. How do you intend to carry out contact tracing, especially since some of those suspected cases involving the members of parliament are people that we've seen in public gatherings and even holding homecoming? So how do you intend to carry out contact tracing of those members of the public who showed up for that event?
Jina langu ni Nancy Okware kutoka KBC. Imekuwa takriban mwezi mmoja tangu makataa ya kutoingia au kutoka katika kaunti ya Kwale, Kilifi na vilevile maeneo ya Old Town Mombasa na Eastleigh kuondolewa. Je, kufikia sasa hali iko vipi katika maeneo yale? Je, wananchi wanakumbatia mikakati ambayo imewekwa, hususan ikizingatiwa kwamba leo hii tumepokea visa viwili kutoka katika kaunti ya Kilifi? Asante.
Okay. Thank you. Helen Aura, NTV. Your question is regarding what I have also read in the papers about certain MPs turning positive. You want to know how many there are and how many are critical. And your second question was, indeed, if some of these individuals contracted the disease from the public gatherings, what is the level of accountability? I think these are loaded questions, and I may not be able to provide you the answers because there are agencies that are responsible for following up on those who might break the regulations that have been put in place. But of course, a link has also to be established that there is a process that led to the spread of the disease. I think you are referring to the case of the first few cases in Kilifi, and we know the index case and the number of people who are infected through that individual. I actually do not have that information as to the number of MPs and how many they are, what their state is, clinical state may be, but Dr. Kuria might be able to respond to that if he does have the answer. Otherwise, he may not have that. We can, if we don't have the answers to that, we will try to get those answers and get them to you at some point. Okay. Chemtai Goin, Citizen TV, is a follow-up on the question from Helen. I think you wanted to know, indeed, if this is the case, what is the level of contact tracing that will be carried out, and how will that be carried out, given that some of these affected persons may be people who are in public gatherings, have been seen in public gatherings before. I want to say to that question that the protocol for positive cases, once they are identified, is to do the follow-up contact tracing, and that is done for any individual who turns out positive, regardless of his station in society. I think the last time we told you, we talked about COVID cases in different places, and we reiterated again that that is the procedure. We must follow the contacts, and we must trace them, we must treat them, we must isolate them. That process will continue. So in terms of contact tracing, we have set protocols which we always follow, and we shall follow those regardless of who is the person who is affected by this. Nancy Okwaro, KBC. Swala yako ilikuwa kwamba tangu wakati ile tumeondoa zile restrictions kutoka Mombasa County na Kilifi County, Eastleigh, Old Town, mambo yako namna gani, si ndio? Well, unajua kila siku tukisimama hapa tunaongea na Wakenya, tuambia Wakenya ya kwamba ni muhimu sana tufate zile sharti zimewekwa. Hizo sharti ndio ni kinga yetu na lazima tuifuate. Kwa hivyo hiyo itategemea vile watu wanajichukua wenyewe, ile responsibility ya jukumu ambapo wanachukua kujikinga na kukinga wengine. Na yetu ni kusema, kuambia Wakenya, tafadhali tuendelee kufuata zile sharti ambapo zimewekwa na Wizara ya Afya, ili tuweze kujikinge na tukinge wengine pia. Na tukiangalia zile manamba ambapo tunapata kutoka testing, tunafikiri bado mambo iko under control. Okay? So wacha nimpatie Dr. Kuria kama ana mwingine yote kuongeza kwa ile nimesema.
Thank you, Kas Rashid. I think the question asked on the number of parliamentarians who have tested positive, how many are in critical condition. I'll also respond to IQ. We don't have the exact figures. We're also learning as you are learning. But maybe to stress most important of this, I do not know why it is important to know how many parliamentarians have tested positive. Because in a way of fighting stigma, it is not important that we know how many bishops have turned positive, how many judges have turned positive. We've urged again and again individual responsibility. The numbers of parliamentarians who have turned positive is not going to help you not turn positive. Whether you are going to follow them in their gatherings is upon you. We've told you again and again, the person standing next to you could as well be positive, including those parliamentarians. So it is individual responsibility. If you think they are in gatherings that have been prohibited, why don't you avoid them yourselves? So while the numbers may be there, I would want us to delink this, and for purposes of stigmatization, let's stop talking about parliamentarians, the clergy, the judges, the police. Let's talk about Kenyans getting infected, and avoid getting infected, avoid those gatherings, whoever has called them. Individual responsibility is what matters most. Thank you.
Okay. We will now do a small ceremonial handover of the donation from UNFPA.